Hi, everyone. Welcome. Good afternoon. Thank you for joining us during your lunch hour. We're really excited to share the information session for our micro-certificate program, Health Data Analytics, Opportunities and Applications. This program was co-developed by the UBC Department of Medicine and UBC Data Science Institute. My name is Steph Chia. I am the research manager at the Department of Medicine, and my team, myself, Marlene Kaur, Sunghyun Kim, we're part of the team that supports the course delivery of this course along with the UBC Extended Learning team. So today we're having this opportunity for you to meet some of our lead instructors, find out more about this program, what you can expect to learn if you take this micro-certificate. And after this, a brief presentation of going through the course curriculum, we're going to have a lot of time at the end for you to ask any questions that you might have, provide some clarity on the courses and what you're going to learn. And we are recording the session, so we'll be posting it online to our website for future reference. So before we begin our session, I want to acknowledge that we are joining today's meeting from the University of British Columbia in Vancouver, BC, which is located on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. This is also where our micro-certificate was conceptualized and developed. I also want to acknowledge that many of you are joining from various locations and territories, and I acknowledge the traditional caretakers of those lands. So this is the agenda for today's session. We'll be beginning with some brief introductions. We'll talk about why we developed this program, the curriculum for each course, goals and benefits, potential career applications of this micro-certificate. And we've also invited a former student who completed the micro-certificate to share about their experience. And then we'll have our Q&A session. So for the Q&A session, we're going to use Slido. If you haven't used it before, you have to open another browser and go to slido.com and enter this number code here. And that's where you can ask questions. You can see other people's questions and vote up a question that you might also want to have answered. During the Q&A, we'll also give you the opportunity, you can raise your hand and unmute yourself to ask a question too. Okay, so we have a very short survey of wanting to know who is in our audience today. And how best we can shape the next hour in this info session to discuss what your specific interests are. So I'm just going to ask Marlene to launch the poll of just kind of finding out more about who we have today.
Okay.
Okay, so their question is, what is your current profession? And then a second question is, which course are you interested in taking? And that you can choose more than one option. And then our third question is just, how did you hear about this info session? So we'll give you, hopefully you can fill it out in the next 30 seconds. Hey, you're just seeing about, looks like majority of people have answered, maybe 2 more seconds, and then we can share the results of the poll. Okay, so it looks like the majority of the people here joining us are health admin staff, other or researchers. There's a lot of interest for, I think, all 3 of our courses, which is great. And then how you heard about us. Thank you so much for doing that poll.
Okay.
All right. So we've put together our program with our program leads here who are today joining us in the info session today. We have Dr. Anita Palpu, Dr. Raymond Ng, and Dr. Palpu is Professor Eric W. Hamber Chair and the head of the Department of Medicine at UBC and Providence Healthcare. She's also the co-lead of the Data Science and Health Research Excellence Cluster at UBC. And we have Dr. Raymond Ng, a professor of computer science at the University of British Columbia, director of the Data Science Institute, and he is the holder of the Canadian Research Chair on Data Science and Analytics. We also have joining our course instructors for each course. we have Dr. Mint T, Dr. Leon Rocco, and Dr. Rob Bergen, who I'm going to introduce later when they talk about each of the courses. So without further ado, I'm going to pass it along to Dr. Palapu, who will provide a program overview.
Thank you so much, Steph. So as you all know, data science is a rapidly changing field and everything is evolving quite quickly. And when we designed this program, we really considered the appropriate scope of tools and skills to include, keeping in mind that the micro-certificate is designed for a part-time audience and delivered entirely online. So the expected workload is about 5 to 6 hours per week, and this can be spread across evenings or concentrated on the weekends, really depending on your individual schedule. Learners can engage with lecture videos from experts in the field, complete assignments and self-check quizzes, and also participate in discussions asynchronously. And while it's optional, we also offer synchronous Zoom office hours for those who prefer live interactions for clarifications or deeper discussion beyond the discussion board. The Zoom session also can be recorded with the permission of those learners who are involved. So the micro-certificate program is also accredited by the UBC Continuing Professional Development for physicians for 75 hours for credit. The micro-certificate is made up of 3 courses. So course 1 is the Introduction to Big Data Era and Opportunities for Better Healthcare. The second is Health Data and Visualization. And the third is Health Data Analytics and Machine Learning. So the courses are independent and standalone, so they could be completed in any order, but we do recommend to do it in the order to get the micro-certificate. Each course is $950, and the entire micro-certificate will be about $28.50. After completing all 3 courses, learners will be able to receive a UBC Micro-certificate digital badge, and it's a credential that can be used to share with your learning achievement with your employer or potential employers. There are 3 offerings in 2025. We've already completed the first offerings of course 1 and 2, and course 3, the machine learning one, will start in a couple of weeks on April 22nd. The next offering of course 1 will begin in May, and course 2 will be in mid-June. I'm going to hand it back to Steph now.
Thank you. So that was a little bit about a very brief overview of how the program works and the number of weeks and expected hours. And I'm going to pass it to Dr. Raymond Ng to share a little bit about why we developed this program and the goals of the program.
Okay, thank you, Steph. So first of all, welcome to you all. Taking some of your time to join this information session. And I'm just going to follow up on what Anita said about the growing field of data science, and I think it really I've been fueled by the fact that in health authorities, hospitals, health research organization, there's a really growing volume of data, of health data, and then different types of data from electronic health records to clinical documents to user-generated content. And at the same time, because we have increasing computational capabilities and the advances of data science and AI, there really is a lot of opportunities for us to take some of those methods and apply to health data so that we could then be able to allow health professionals to make better use of the data to improve healthcare, work more effectively with analytics professionals. But importantly, I think through this micro-credential program, we really want to improve the data literacy of the healthcare ecosystem, so that the professionals within the system could capitalize on health data science and eventually build a active, viable community of practice in BC. So next slide. We have invited lecturers from multiple institutions across BC, BC Cancer, Fraser Health, Providence Health Services, Authority, Vancouver Coastal, just to name a few. And the idea is that we really want to, bring to you the state of the art, researchers and or clinicians that could share with us how, in their perspective, how they use data and how they use data analytics. So let me answer the question of who is this micro-credential program for, and how could you as a learner benefit from this program? The important thing is that we specifically designed for healthcare professionals, and Anita already talks about how this is online, and we are designing this for people who will be able to upskill themselves while they are continuing with their with the daytime job. So we try to be very practical, knowledge and skills oriented. And we have lectures, but we have labs and assignments, and so that people get hands-on experience on some of the skills and tools. And I mentioned about the upskilling aspect of this program that really allow you to take your experience, your background, but now help you with literacy and a level of skills in the massively changing, advancing field of AI and data science. And the idea is that once you have those concepts, it will allow you to apply those skills in your day-to-day work. If not directly, it will certainly allow you to feel comfortable using those tools in your workplace. And so, as I mentioned, the idea is that we would like to build a viable community of practice. I guess the last comment that I will make is that this is a micro-credential program. Even for the 3 courses, is really, literacy and, basic skills. This is not intended to say that after you have taken the 3 courses, you will become a professional, data scientist in healthcare. In order to do that, you will need to take some additional courses. But I would say that this micro-credential, program will be a stepping stone towards that. If after you have taken this micro-credential program, you feel like that you really like the material and you would like to go further, this micro-credential program, I think will be very useful, for you to go on to take additional courses. So with that, I'm going to pass it back to Steph, and we're going to talk about each course in a little bit more detail.
Okay, thanks, Raymond. So we're going to talk about each of the 3 courses that make up this micro-certificate or the micro-credential. So first, for course 1, I'm going to introduce Dr. Mint T, the assistant professor in the Division of Social Medicine, and is also a research scientist and health administrative data lead for the BC Centre on Substance Use. She's an epidemiologist by training and leads a project of a province-wide population-level linked administrative cohort. So that aims to evaluate naturally occurring policies and interventions to optimize health systems for people living with substance use disorders. So Mint, please feel free to share about what course 1 is about.
Thanks, Steph. So the first course really is trying to provide an environmental scan of the current landscape of, what health data is available in BC. And it's, while it's not exhaustive because there's so much data out there, it's probably the main sources of data that folks usually work with when they're working in the data science field. So we talk about available databases, the platforms and where the databases live and how to potentially access them depending on where, if you're affiliated with a certain organization. And then also we give an overview around the application of data analytics in healthcare delivery. So the course The first course really is an introductory course and uses specific examples, both from kind of the clinical standpoint and operational standpoint, but also a research standpoint. And so you'll learn about specific examples like the use of AI and computer vision for echocardiography, natural language processing for mHealth, and also some work that folks at the Emergency Health Services does around ambulance deployment and using data for healthcare operations purposes. And really the overarching goal of this course is to help learners understand how to identify the right data sets or right sources of data, and some very preliminary cursory analysis techniques for impactful health data applications. I'll pass it back to you, Steph.
Thank you. Thanks, Mint. Again, if you have some questions about what you're hearing about the different courses, feel free to add them to the Slido channel. Okay, so for course 2, I'm going to introduce Dr. Leon Ruocco, who is a data scientist at the UBC Data Science Institute and one of our instructors for course 2, Health Data and Visualization. He holds a PhD in physics from UBC and works on artificial intelligence and machine learning solutions to problems in healthcare. So Leon, please, and feel free to introduce course 2.
Hi, everyone. Thanks for the introduction, Stephanie. So I'll give a brief high-level overview of the course content for the second course, Health Data and Visualization. And as the title of the course suggests, we'll be studying key aspects of health data itself, data visualization, and then perhaps a third important pillar of this will be scientific communication and communication skills in this field more broadly. So to give you an idea of what we mean by health data in this course, we'll be discussing things like how data is processed, cleaned, and ultimately stored. And so we'll be going into some of the specifics of data warehousing, which is a very important concept in this modern era of big data, and this is especially relevant in healthcare, where of course large quantities of data need to be stored and structured in preparation for downstream analysis. We'll also be spending significant time discussing how data can be explored, especially from a visual perspective. So in other words, how to present data graphically, in an informative way, and we'll discuss some of the scientific best practices here. And this will dovetail nicely into data communication skills, where we'll discuss principles of study design, how data should be collected in a meaningful way, such that we, mitigate things like bias and confounding. So this will be especially relevant for when we critically analyze some, research papers. And finally, we'll also touch upon important ethical considerations when collecting, storing, and presenting data. Something that's always important to consider. Whether you're conducting a study experiment, conducting analysis, or even just storing data, these ethical considerations come up. So I'll pass it on to the next person then.
Thanks, Leon. All right, so that's for course 2. And then our final course that makes up the certificate is micro-certificate is instructed by Dr. Rob Bergen, the senior data scientist at the Data Science Institute. He has extensive research experience in medical imaging and generative AI, and he'll tell you more about the course 3, Health Data Analytics and Machine Learning.
Yeah, thank you for the introduction. The third course introduces more advanced analytical tools, including a variety of machine learning models that are commonly used in healthcare today. And the course is designed to circumvent the need for any programming skills, but we do use a software tool called Weka. And what that does is provide us a glimpse of what machine models are doing under the hood, so to speak. So using this tool, we can build some models on data sets, which will be provided in the course, and learn how, by modifying different aspects of those machine learning models, how does that affect our predictions, for example. So it's a great way to learn hands-on and gain experience building models, identifying trends, and exploring some real-world applications. So the course will also touch on natural language processing, a branch of AI that uses machine learning to enable computers to understand and communicate with human language. And so this will focus a lot on clinical data, introducing concepts of text analysis, and as well, we'll have an overview of medical image analysis. So within these domains, we'll see a high-level overview of how some of these advanced models work and different strategies to either adopt or avoid when using these tools. So the curriculum as a whole is designed to provide a strong foundation in health data science and build practical skills applicable in the healthcare domain. And I'll pass it back to Steph.
Thank you, Rob. Great. So you heard about all three courses. And again, please add your questions to Slido. If you have specific questions for the instructors, they'll all be available for the Q&A. But before we get to the question and answer period, we're going to hear from our former student about their experience. So I'm going to introduce now Kenny Hammond, who recently completed the micro-certificate last year. Kenny is the manager for research data services at Digital Solutions in the UBC Faculty of Medicine. Kenny holds an MPH, and he has been working with medical education and research field since 2009. And he strives to engage with clients to find technical solutions to support their needs, whether it's for research or medical education. So I'm just going to stop sharing, and then I'll invite Kenny to unmute so that we can, I can ask you some questions about what you thought about the course.
Hello, hopefully everyone can hear me.
Yes, great. Okay, thanks. Thank you, Kenny, for joining us and sharing about your experience. I wanted to ask you first why you decided to take this micro-certificate.
Yeah, thanks for asking, Steph. As I reflect on this question, I think the reason I decided is because I lack the fundamental language in this space to communicate with my colleagues and peers and people who are actually reaching out to me for support. So I didn't really have a great understanding of what health data science was. And because of that, I probably, could only go up to here in my career. Since I've actually taken the course, I actually use it every day in my work. I used it this morning talking to a PI, a researcher, about one of their projects and some visualizations they were hoping to do. And it's been incredibly impactful. I think, moreover, I wanted to understand what type of data sources were out there. I work a lot with the research community all across the Faculty of Medicine and even beyond, and being able to point them in a direction of, do you know this source? Do you know this exists? It's incredibly valuable, not just for me, but for the people that I work with. I like to use a statement, it's who's who in the zoo. I have a better sense of that now, and I'm able to really point people in the right direction. And then I think the other piece that made me kind of take it, and I think it added value to my career, was really upskilling. I now have a much better sense of, things along lines of, data analytics, data visualization, machine learning, that I can actually speak and have conversations in a richer way that are actually more valuable. So that was a big kind of, I think, benefit for me. And to speak on my colleague, because my colleague Anastasia also took it, and she sent over some notes, but she unfortunately lost her voice. Her big takeaway why she wanted to do it was to stay kind of current with the best practices and to build knowledge that she could share with researchers that she works with.
Great. Thanks, Kenny. Yeah, it sounds like there's a number of reasons why you were able to take the course and how it benefited your career.
Oh, yeah.
My second question for you is, of the three courses that you took, was there something that you enjoyed the most out of one of the courses or the entire program in general?
For me, it was the presentations, because they were really kind of unique and they were interesting and they were engaging. The presenters were well spoken, and the presentations resonated with me. There is a presentation, I know it was mentioned, about ambulance resourcing. I actually think about this all the time. I see an ambulance and it's like, oh yeah, this is interesting. It just ties things together in a richer way, and it really left an impression. But then when I get to work with the research community, I get to kind of tie it all together and kind of give them ideas on what they could do, which I think is really helpful. The discussions also were really engaging. and they were actually fun. Like I actually didn't dread doing the online discussions, which as someone who did a online master's program, it wasn't my favorite part. But for this program, it was actually incredibly fun. And I think the last piece that I really enjoyed about it, it was trying to find the right words here. It wasn't boring, and I don't know how to actually say that. I just did another online certificate, and comparing the two, I can't.
Oh.
So it was really engaging and fun. I think that made it really good for me.
Great. Okay, good to hear that you weren't bored. And I think that was one of the goals, is like to have those different
Yeah.
types of learning experiences, like through the videos or discussion, the self-check quizzes. And you kind of touched upon like our goal of kind of building that community of practice that Raymond mentioned, of just meeting the other students who are doing the course with you, and talking to them through the discussions. So that's really great that you had that experience. Was there anything that surprised you about the program, like something you thought would be different than when you actually went through the program?
I had no idea how much was happening in British Columbia in this space. I just couldn't even fathom all the unique programs, projects, and things people are doing. Not just using machine learning to inform clinical processes, but just in general, some really interesting things. So I think that was what surprised me. It's just the breadth of people doing work in this field. And it was fairly inspiring. I found it really great.
Thank you. Thank you. And I just want to note for the students, we do regularly review our content to make sure our curriculum's up to date, and we will make, updates every so once in a while to keep on improving our curriculum as the whole ecosystem changes and new tech tools come out. We do work on updating our curriculum as well. Okay, so last question for Kenny actually was, do you have any advice for students, maybe the potential students who are in the call today, for if they want to get the best experience of taking the micro-certificate?
Yeah, because I think I probably did this when I was doing the micro-certificate. Start by thinking of the problems you have every day in your work and how data could help you. And if you keep that front in mind as you do it, you're probably going to get some real gems out of the program and really learn some amazing things. Um, it actually does give you space to be creative, which I thought was really fun. There's a final assignment in course number 2 that actually was creative, and you can kind of do different things with it. And I think that's really enjoyable. I think just from a practical standpoint, don't be don't leave everything to the last minute. I say this as I remember texting Anastasia, a couple hours before the end of something, be like, oh, we really need to like do more right now. So I would block off time and actually, try to find time to sit down and devote to this, because you'll get more out of it that way. And then don't be afraid to reach out to some of the colleagues in the program that are doing it with you. A bunch of them reached out to me and asked me questions about my career, and a couple of them still keep in touch with me, which I feel was really nice. So you can actually make some connections, and
Yeah.
it's like kind of like digital networking. So it's really, you can get a lot from it. The final thing I would say, the final course is a little more technical using the software. I would encourage everyone to dive in, because the software is nothing to be scared of. And it's actually quite easy to wrap your arms around once you follow the training that the actual course provides. So although it's something new, it's really fun and rewarding to actually see the outputs when you're working with it. So I think that would be my advice for everyone.
Thank you. Thank you so much, Kenny. And again, thanks for giving up some time to share your experience. We really
Oh.
appreciate it.
Anytime.
Okay, so that is the end of our presentation portion of our info session. We're going to switch over to the Q&A. So I'm just going to ask Marlene to pull up the Slido questions so that we can all see what questions we have. And then we will have all of our instructors and program directors can help answer your questions.
We have some questions in the Slido.
Are you sharing your screen?
Yes, I will now.
Okay. question number 1. Are there any prerequisites? No, there are no prerequisites. Raymond, do you want to expand further? Or is just there are no prerequisites for the course?
Well, so the answer is no. And I think Rob already mentioned that we don't expect any programming experience. And Kenny talked about using the Weka software, and it's just a piece of software that I think you need to work with. And I think it's it should be quite intuitive. So yeah, we intentionally made the entry point to be to be 0 for anybody from the healthcare sector.
Thank you. Okay, second question is, how do these courses transfer or synergize with further training or credentials? Courses transfer. I don't think you can use them as a transfer for other credentials, if I'm not mistaken. Like the 3 courses themselves make up our micro-certificate from UBC. But Raymond, you had mentioned about how this can be a stepping stone for people who want to get their feet wet with health data analytics. And then if they're really interested to go down a career path of data science, data analytics, they can go and take further courses from the data science field.
Yeah, so one of the program that has been quite prominent offered by UBC is the Masters of Data Science, and that is a 10-month program. And the intention of that program is really trying to train the graduate so that they could be a data scientist in whatever domain that they come from. So it's not specifically to health, but the material has certain degree of overlap. So for example, in the Masters of Data Science, there are quite a few modules on machine learning, which is cost-free. I think there are some modules on data visualization, storytelling. So this is, in that sense, that is really a stepping stone for a program like Masters of Data Science. Even though, strictly speaking, I don't think there is a direct transfer agreement that has been set up. But it's not just about the Masters of Data Science program. All across Canada, now there are professional degrees for data scientists. So I think then, this is what I'm referring to, that if you decide after you have taken this micro-credential program, you really like the area and you really think about maybe, being a professional, then you would consider those other programs that would allow you to accomplish that. I don't know whether Anita want to say something about CPD, because I don't know whether there's any connection on the CPD land when it comes to.
No,
yeah.
There's not. But we are also developing another micro-credential in natural language processing. And there may be an opportunity to stack these together, but we have to talk to extended learning. So it's a bit premature to say in terms of credentials yet. Thanks.
Yeah, that's right. We were in the process of developing a new program that's in the natural language processing field. And if that would be a micro-certificate, and you took this micro-certificate, there's potential it could be a UBC certificate. But still, yeah, that would be 2026 if that happens, to do the certificate, stacking part. Okay, so again, if one of these was your question and we maybe didn't fully answer it, like feel free to raise your hand or re-ask something in the chat. I'm going to go to the next question about what programs and or softwares does the course require. From my knowledge, the only one that I can think of is course 3, where you use the Weka tool. There are some, I think, basic computer requirements you need to run Weka. Rob, do you know what those are? But I think it's pretty basic from what I understand for running Weka.
Yeah, I don't know the requirements offhand, but it's very accessible. It'll run on any operating system, and you don't need a beefy GPU to run this software. Any kind of consumer grade laptop or computer will be able to run it.
And course 1, nothing Mint? And course 2,
No.
Leon?
No requirements for course 2 either.
Okay. So the next question is, how can this certificate help me find a job in health data analytics? I guess my question for the person who asked this was, I mean, what type of job in health data analytics are you looking for? If, like we mentioned, that this is not, you're not going to, by taking this micro-certificate, it's kind of exposing people who are in the healthcare field to data analytics to better understand how the health data that you see and how it can be used, and possibly work with with data scientists. So it wouldn't be a job that a data scientist role that you'd be able to do, but it's like for the healthcare professionals, like if you're in allied health, you're a care physician, you want to know what's happening in this field, and that will allow you to, I think, expand the opportunities for you to work with the people in the data analytics, data scientists. I don't know, Mint, your kind of work in that health data analytics, like, is there anything you want to say about what other types of roles would be applicable?
Yeah, I mean, I don't have much to add other than what you mentioned, Steph. It's definitely for, the healthcare professional that wants to learn more or kind of be better versed in, the data analytics field, and not like this. The course isn't going to, prepare you to get a job as a data scientist or a, statistician or something like that. But, to better have conversations with folks who are data scientists, so that you can, kind of work with the more technical folks, to understand or develop questions to help answer within the health field.
Yeah, and I think from what we've seen is that more and more of these like tools in health data analytics, even the AI tools, they're coming into the healthcare field, and then people who are in those positions, like these are all new tools that are being used or have potential to be used, and they don't have the data literacy to really fully understand how to use the tools or like what they do. So that's the purpose of this course, is really to help people who aren't from the data science field learn the foundations and then see how it can be applied in the healthcare setting.
So Steph, if I may add, I think this is definitely not trying to find a job in the health data analytics. But having said that, I think take course 3 as an example. I could imagine, I think there's something that Kenny alluded to, that in your current job, if from time to time you have a project or you have an idea that you think, oh, if I have access to that data, maybe I could do something about analyzing the data, and from that perspective, I think the Weka software is actually good to do it. Just either for fun or as some kind of an initial hypothesis that maybe you could push it further in the workplace. And so I think that is the kind of, so it's not a job, but it's certainly, side projects that I think our graduates may be able to do with, using the right data, be able to, build the right models, and that would be interesting. So this is, what we are alluding to, this community of practice idea.
Thank you. So the next couple questions are around the course fees, I think, and how does it work? Are we going to pay for all the courses in advance? Any fundings? And then another question about whether UBC faculty members have to pay for the course, or is it waived? So for the course, you don't have to pay for all 3 courses in advance. You can register 1 course at a time, And because we have multiple offerings of the courses, you can choose, you don't have to do it all back to back. You can say, I'm going to do course 2 now, and then in a few months, there's another offering of course 1 happening, and then course 3 later. So we are continuously running the offerings, and you'll just check our website for the next course dates. So you just pay per course. And then for fundings, we're anticipating that a lot of if you're employed by a health authority or like healthcare service agency, there's hopefully some professional development funding that could be accessed through your work that could go towards the course. UBC staff have a tuition waiver that allows them to be used towards this program. And then other fundings, that is something we're also kind of working with the ministry, BC ministry, to offer some tuition subsidies or for special groups of people. So that's something that we're trying to work on, to offer some with the ministry partnership, or even through ourselves, to figure out what tuition subsidies we can offer to people. It's not set yet, but we're working towards that. Does the faculty members have to pay for the course? So my understanding is there's also tuition waiver for UBC faculty, and that can be applied for this course. Did anyone have anything to add from our instructor?
I mean, UBC faculty member has professional development fund, so for sure that would be applicable.
Mm-hmm. Okay. Are there any other associated costs, textbooks or WECA, if I missed the cost of that? No, there are no other associated costs for no textbooks that are paid, need to be bought, or WECA is a free tool. So I believe that all the course fees will cover your participation in the course. Okay, this is a good question of what is the reason why the WECA tool is used? Is this the standard tool for machine learning in the healthcare context? Can this tool also be used in other fields? Rob, did you want to take that one?
Yeah, sure. So traditionally, if you're a data science working in any field, you would be designing these models using something like Python or R, like a programming language. And we want this course to be accessible to everyone, right? So WECA is just a way to abstract all of that away and allow us to use a bunch of these different common machine learning models within one framework and one package. So it's very easy to use. It's very easy to modify models without having to know any programming language. And it's very easy to visualize the results, once your data is input and the model is run. So yeah, it's just a very easy way of getting hands-on experience without requiring any detailed knowledge of, math and programming and stuff like that.
Thank you. And then do the courses need to be taken in a certain order? We mentioned that no, they're standalone courses. Like the way they're designed, it flows nicely 1, 2, and 3, but it doesn't have to be taken in that order. And you can choose when you want to take which course first and the timing of it when the offering comes. The question is, have you had any students from outside of BC? How was their experience, and did the training positively impact their careers? Unfortunately, I don't think we have any information about any students outside BC. The majority of people who took this course, from what I looked at the student enrollment, were from BC or living in BC. So I can't speak to anyone from outside BC, although we had, I think there was a question about whether somebody from Alberta wanted to take the course. And we mentioned that course 1 is quite BC focused. Mint, you kind of mentioned, we talk about the BC data holdings that are like in the province. So that might be a little bit out of context for some people out of the province. But then I think the other parts of the course, we can see the other parts of the course are definitely applicable to if you're outside BC. So just the foundations of like, what does it mean to do the data cleansing or that data visualization is definitely applicable outside the province, and as well as course 3. So my opinion was that the first course might be a little bit is more BC focused. Mint, do you want to share anything about that or agree?
Yeah, I think, I mean, I've taught this course for a couple of years, and I think there's always sometimes there are a couple of people that are out of province, but I think they join with the understanding that all of the data sets and, how to access data, kind of the practical aspects of data access is BC specific. So, now with like multi-jurisdictional type research that are like cross-provincial, like there might be folks in Ontario who, might want to work with BC data in addition to Ontario data. And so this, or at least course one would be applicable in that sense. But yeah, we don't talk about any data sets outside of BC.
So I think this question is, I have a BSc in nutrition and dietetics. I have no knowledge about programming or language. Do you think it would be helpful if I'm thinking to switching careers? I mean, I guess it depends on what career you're switching to. The no knowledge of programming or language, that's kind of what we were saying, like that's why we designed the course how it is for people who don't have that background. So no issues there. I think maybe the questions about the switching careers, maybe you can email us and we can maybe advise a little bit more on what your career goals are, and whether this certificate can help you get there. Can we communicate via email with previous students like Kenny? Kenny, are you there still?
Yeah, of course. If anyone has any questions, they can definitely have my UBC email. Totally fine.
Okay. Yeah, you can find him on he's on the UBC website. So
Yeah.
Yeah. I think we already answered the financial aid options question. If you are a UBC research assistant in the healthcare field, will this certificate help increase wages, steps, or advance your role? Yeah, that's in the healthcare field, UBC research assistant. I mean, it's definitely upskilling yourself from somebody who has no knowledge of health data, knowing how to work with health analytics. I think that makes you very more, what's the word, like valuable to your employer. I can't speak about the increase in wages and steps in advance. I'm not sure what the employer's pathways are, but I think that's something maybe you speak with your supervisor or manager about, of whether do they see there's like a potential for a reason why you can take this program and upskill yourself to learn a new set of like skills that could be applied to your role. I think it's very role specific and employer specific. Okay, so the next question is, are participants allowed to freely use any of the data sets used in the course for purposes of research or developing a research paper? What permission is needed? Does anyone want to have a stab at that question? Raymond?
I would think that generally no. Access to data is, I mean, I think Kenny was talking about, who's who in the zoo. So from that standpoint, it's good to know that certain data sets exist and certain types of data, exist. But knowing that the data exists doesn't mean that you have access to it, and that's a different consideration. And so if you are really thinking about using the actual data to carry on with your work, you need to make sure that you talk to the data owner or the guardian of the data set, and make sure that you have the access right. And then even when you have the access right, it also doesn't mean that you could use it for any purpose that is that goes beyond even the consent that the data owner has. And so that to some extent there's really a lot of different levels when it comes to using data, and so So I guess I'm already talking about some of the issues in course one.
Yeah, I would say, just to add to what Raymond said, is course one will learn, I guess people will learn how to, like, what pathways to access data. And then, there's a lesson around, ethics and privacy and confidentiality and use of data and things like that. But there's also other lessons within course one that talk about, access through, PHSA's Panda platform or the health data platform from the BC government or Population Data BC, depending on what kinds of data sets you are interested in accessing. And then, the actual practice of getting access to those data sets is beyond the scope of the course. But I think and as well as I'm sure other folks here who are familiar with how to access those types of data are always here to help support for people who actually want to, turn, your capstone project into like a real project. And that's, we can always talk about after the course.
Mhm. Okay, just looking at the time, we have maybe 5 more minutes if there are more questions. That I think this last question here is about the format of the course. Is it purely online, or are there virtual classroom components on certain days? And yes, both the correct answer is yes to those questions. It is 100% online, and there is a virtual classroom component, which is the office hours, 1 hour weekly with the instructor, Leon, Rob, and Mint, for each of the courses, where you can ask questions either about what you learned, the lecture videos you watched, or on the assignments. And that is on a set hour on the day of the week. So that's the portion where it's live in person and you can interact with the instructor and other students. Do we want the last question here is about, I currently work in a warehouse, interested in transitioning to a health data analyst role. Could you assist me in this career change? Yeah, so I think we were just mentioning, like, this course is for people in the healthcare professional, in the healthcare field, who want to learn more about data analytics. So if you want to be a data analyst, there may be other courses that are more appropriate. So if you have questions about those, like Raymond had mentioned, like the Master's in Data Science, master's degree from UBC is one, and there are also multiple courses in data analytics, specifically to become a data scientist. So yeah. Is that the end of the questions, Marlene? Yes.
Yes.
Okay, great. That's good timing for us. Hopefully everyone learned more about what our micro-certificate is about. We hope you got the information you need. And if you didn't, please feel free to email us your questions. I think we can put the registration link in the chat too, for just where you can find more information about the course, each of the 3 courses, and the dates, the course dates that are coming up. And we just want to say thank you all for joining us today. We hope you do, if it feels right for you, we do hope you can take the opportunity to register for one of the courses.